Baby burn, yep. We're already up to 76 degrees at 7:15 in the morning as we look at the sunshine outside on our roof cam, and we welcome you back. Well, the UK is ready to remove the last of its COVID-19 restrictions later on this month. As of July 19th, British citizens will no longer have to wear masks indoors and social distancing limits will be removed. British Prime Minister Boris Johnson says the emphasis will be on personal responsibility instead. Masks will still be recommended in some situations. This comes after 16 months of shutdown since the pandemic began. At least 86% of adults in the UK have gotten at least one dose of the vaccine, but COVID cases have been surging because of the spread of the Delta variant.
You know, Randy, you and I have been working all through this pandemic. Getting out and about with people is nothing new, but for some folks, going back into the office or even going to church or synagogue or place of worship, dining out again inside all of these places can sometimes flip a switch and they feel a level of anxiety. And we've got Counselor Dr. Rachel Glik joining us this morning. This is something, now I don't know if you came up with this. Welcome, doctor. This term.
It's nice to be back.
It's good to have you back. Look at look at how close we are.
Yes.
COVID reentry anxiety. Is that your term?
No, that's something that's been coined by APA. And
So it's really going on.
oh, it is. Yeah. Yeah. I mean, a lot of people are really comfortable going back and excited, but many people, they say like 49% are feeling some sort of fear or worry, and it's triggering other kinds of anxieties too.
I went to the dry cleaner yesterday. I was walking in, and I had my stuff. All of a sudden, there's a sign that says, "Put on a mask." I felt anxiety. Yes. I don't have a mask. What do I do?
Exactly.
You know, it's just the opposite.
Right.
But for other folks, it's like suddenly they're out there, they hear somebody cough, and it's like PTSD. They bristle.
Exactly. Yeah. The nervous system is responding to how it's used to, the pathways that it's used to safeguard and to protect. So some of it is physical fear, but health fear. But then there's a lot of social anxiety that's being triggered.
So I tell people, okay, so you're vaccinated, you're fully vaccinated. Yeah, you don't have to really worry about it. It's the people who aren't vaccinated or the kids. And so if you're not around kids, do you really have to worry about this?
Well, I sometimes it's not necessarily as much about the logic of the
It's up here in
exactly.
the head.
It's and the way we've been in such a shutdown and such a safe zone, it's really a lot of the social skills have atrophied for a lot of people.
Oh, that's for sure.
And I've seen it with kids that they're getting used to more of the videos and communicating over video games and not really comfortable coming back and talking one-on-one.
I noticed with some of the kids, they don't look you in the eye. And maybe that's always been, but I'm more aware of it now.
Yeah.
So what is some advice that you
Well, the
have?
first thing is not to judge yourself, because it's very common and it doesn't help to grow and to overcome things when we're judging ourselves. It actually makes it worse. And then secondly, also see it as an opportunity, because wherever our fears are is exactly where our next level of really feeling fulfilled is going to come from. And then the other thing is really to monitor your self-talk. And how is it that because that's what creates the emotion, is how you're thinking and talking to yourself. And I recommend creating a safety mantra.
What's that?
Like it's something you repeat again and again. It takes constant practice and to shift your mindset. And so it could be something that I'm safe, I'm confident in my abilities, I am enough, because a lot of the social fears of being around people again.
And it takes time to build that up. I mean, I
Yes.
was visiting my mother right in April when all of the restrictions were being lifted. I said, let's go out to dinner. She said, no, I really don't want to.
Right.
And I talked to her recently. She goes, I've been out to dinner. And it was a major accomplishment.
That's
She's 94
amazing.
years old, so.
And that brings up another really good point, which is to like small steps or big steps. And when you feel the inclination to avoid, really have to go against that inclination, because the only way to overcome the fear is to face it. So, we are often surprised at how much we can accomplish and what we can really do it, and to not really listen to the voices in the head that are really becoming really more catastrophizing. That's when it's not fear anymore, like an adaptive, healthy fear, and more of anxiety that's irrational.
Yeah, I miss those days when nobody was on the highway. I had the whole highway to myself. Just driving and going into a place to buy something.
Yeah, for sure.
Crowds are coming back.
Yes, yes.
Which is a good thing.
Yeah, absolutely.
Dr. Rachel Glik, thank you so much.
My
We appreciate
pleasure,
it.
my pleasure.
And we need to know, because you're going to be leaving soon, we need to know about the traffic out there.
Yeah, well, so far it was good. It's pretty early in the morning.
Did you hear that, Molly?
I heard you, John. Hey, I miss those days too.